Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Energy drinks have three components, glucose, caffeine, and carnitine. Carnitine is a component of red meat. For example, a 8-ounce steak might have 150 to 180 milligrams of carnitine, whereas an energy drink could have approximately the same amount of carnitine. Carnitine is converted into a chemical in your body that has been shown in mice to cause atherosclerosis. And it is also found in humans that levels of this carnitine byproduct are increased in patients with heart disease. So we think that this component, this breakdown product of carnitine, causes plaque buildup, and it could be an extra dangerous component of the energy drinks.
When it comes to energy drinks, how much is too much?
Patients who have heart disease, number one, should not be drinking energy drinks. Patients with high blood pressure or palpitations should probably also avoid them. Younger, healthy patients, I would say possibly one a day is okay.
Do all energy drinks pose the same risk?
No, they vary in terms of their caffeine content. For example, a 16-ounce energy drink could have as much as 160 to 300 milligrams, even 500 milligrams of caffeine, which is regular coffee would be about 300 milligrams of caffeine. So they have a lot of caffeine. And also there's other ingredients, for example, carnitine, which could contribute to heart disease. The carnitine content varies. And also the glucose content. There's a lot of sugar, as much as 60 grams in a 16-ounce serving.
For those that drink energy drinks regularly, what should they be aware of?
Potential side effects could be palpitations or racing heartbeats. They do increase your blood pressure to a small degree and your heart rate acutely. You may think of it as an alternative to coffee if you need perhaps a energy boost, but I wouldn't recommend them to improve exercise performance or anything like that.
Is this an issue for teenagers and children as well?
There seems to be a trend where younger people tend to consume them more frequently. You really need to read the labels and think about what you're taking in, because there's a lot of calories in it. And also definitely for persons of drinking age, you should not combine them with alcohol.
When working out, what do you recommend as an alternative to an energy drink?
Water and sports drinks like Gatorade or Powerade, which can improve hydration, but don't have the additives like caffeine and carnitine. And in contrast to sports drinks, energy drinks actually have diuretic effects, so they will actually cause you to be dehydrated because you'll be urinating more frequently. The older you are, the more likely you are to suffer the side effects from the energy drinks, and certainly the older you are, the more likely you are to have high blood pressure. So there's no cutoff per se, but they're generally safer for younger patients without any medical problems. Children, I would not recommend energy drinks for, because the caffeine is very high, even for an adult. So I would not recommend them for children.